We begin now with the re-emergence of Ebola in Guinea. The World Health Organization deployed specialists to Southeast Guinea on Friday after 2 new cases were confirmed. The government says 2 people died from the Ebola virus. A source close to the local anti-Ebola coordination team said the deceased were a married couple who had both shown symptoms of vomiting and diarrhea. Test samples from the 2 patients revealed the presence of the Ebola virus. The cases are the first in Guinea since the country was declared Ebola-free at the end of last year. Now, according to the WHO, a mother and her 5-year-old son, who are relatives of the deceased, have also tested positive for the Ebola virus. The 2 have since been taken to a treatment facility. Well, let's bring you more on this now. We're joined by Peter Graff, who is the head of WHO's Ebola response. Peter, of course, it's just been 3 months that Guinea was declared Ebola-free, something of a setback. How do we explain the new cases?
Well, this specific case, the jury is still out there. A team has been dispatched to find out the specifics as to what might have happened. We have had previous flare-ups in both in Guinea, Sierra Leone and in Liberia. And the cause of this flare-up, which is not related, most probably is not related to the original chain of transmission during the large outbreak, can be viral persistence in survivors, in the bodily fluids of survivors. Not very likely, but it does happen. And of course, we have a large number of survivors. A second possibility is a relapse, so somebody who falls ill again. That's extremely rare, but we have seen that as well. And then a third possibility is reintroduction through animals. So for this specific case, the investigation is ongoing, but it's not. Let's say it was foreseen that there was a likelihood that these cases will still occur for the remainder of this year.
Well, as you say,
very unfortunate, but not unexpected.
And as you say there, Peter, there have been, of course, previous flare-ups in both Sierra Leone and Liberia. You've given some reasons for those flare-ups, but what is it going to take then to essentially keep these countries Ebola-free?
Well, first of all, the countries have to accept that Ebola is now a disease that in all likelihood will come back from time to time, just because the virus will survive in animals. So just like other countries on the African continent, in Uganda, DRC, etc., the Ebola is going to come back from time to time. What is the most important thing right now, and what we're seeing at the moment in Guinea, is that when there are unexpected deaths, there is a prompt investigation. The people affected, both those infected and their immediate surroundings are isolated, tests are done, and then the proper care is provided. So it's a rapid, so it's as much as possible prevention, but also a detection and then treatment of the cases. And of course, the healthcare providers in the 3 most affected countries, including Guinea, nobody else, unfortunately, nobody else in the world is as well trained as they are right now.
Well, as you say, Peter, this Ebola will return time and time again, but is there essentially any risk that we might see a return to the kind of high casualty outbreak that we saw over those 3 countries?
I seriously do not think so. So, first of all, the signals get picked up quickly. In the previous flare-ups that we saw in the other 2 countries, we only saw 1, maximum 2 generations of cases, very quick isolation, very quick treatment, the proper lab infrastructure to test and confirm that indeed it is Ebola. So a much more agile, a much better equipped and a much better trained workforce to deal with this disease. So there will be cases going forward, hopefully fewer and fewer in the months to come, with the survivor population having less chance of passing on the virus, but also, as I indicated, with a real chance at some point in time a re-emergence through animals. But so I think that collectively the responsibility from governments, but also from partners, including the World Health Organization, is to ensure that there's a system in place that is strong on prevention, that is particularly strong on detection, so a surveillance system, and has the mechanisms in place to test and treat thereafter.
All right, Peter Graff, we'll leave it there. Thanks very much for that update. Speaking to us live there from Geneva.